Namaste, Dr. Divya here. Welcome you in the session of yoga therapy. Today we are going to learn about the neurological disorders and in the neurological disorders about the epilepsy. So we'll start this. Epilepsy, also known as a seizure disorder, is a brain condition that causes recurring the seizures. There are many types of epilepsy. In some people, the cause can be identified. In others, the cause is not known. Epilepsy is common. It's estimated that 1.2% of the people in the United States have active epilepsy, according to the Centers for Disease Control and Prevention. Epilepsy affects people of all genders, races, ethnic backgrounds, and all the ages. Seizure symptoms can vary widely. Some people may lose awareness during a seizure while others don't. Some people stare the blankie for a seconds during a seizure. Others may repeatedly twitch their arms and legs and movements which is not known as convulsions. Having a single seizure doesn't mean that you have the epilepsy. Epilepsy is diagnosed if you have had at least two unprovoked seizures at least 24 hours apart. And unprovoked seizures doesn't have a clear cause. Treatment with medicines or sometimes surgery can control seizures for most people with epilepsy. Some people require lifelong treatments, for others, seizures goes away. Some children with epilepsy may outgrow the condition with age. So, what are the symptoms in that? In particular, the seizure symptoms vary depending on the types of seizures. Okay, there are different types of seizures as well. Because epilepsy is caused by certain activity in the brain, seizures can affect any brain process. Seizure symptoms may include the temporary confusion, a straight spell, you can say the stiffness in the muscles the person will get, also the uncontrollable, the jerky movements of the arms and the legs, loss of consciousness. They doesn't even aware about the environment, what is going on, and even they doesn't like to cover it. If you cover it, it will feel loss of consciousness more and more. So psychological symptoms such as fear, anxiety, delay, the deja vu, etc. Sometimes people with epilepsy may have changes in their behavior. They also may have symptoms of psychosis. Most people with epilepsy tend to have the same type of seizure each time. Symptoms are usually similar from episode to episode. What are the causes behind of epilepsy? Epilepsy has no identifiable cause in about half the people with the condition. On the other hand, the condition may be traced to various factors, including the genetic influence. Some types of epilepsy run in families. In these instances, it's likely that there are genetic influences. Researchers have linked some types of epilepsy to specific genes. But some people have genetic epilepsy that is not hereditary. Genetic changes can occur in a child without being passed down from a parent. Okay, let's suppose the parent doesn't have the epilepsy, but child will get. How? Because there are the genetic mutations in that. For most people, genes are commonly part of the cause of epilepsy. Certain genes makes a person more sensitive to environmental conditions that triggers the seizures. Head trauma as a result of a car accident or other traumatic injury can cause epilepsy. Factors in the brain tumors can cause epilepsy. Epilepsy also may be caused by the way blood vessels form in the brain. People with blood vessel conditions such as the arteriovenous malformations and the cavernous malformations can have the seizures. And in adults older than age of 35, stroke is a leading cause of the epilepsy. Infections like the meningitis, HIV, and also there are other and some parasitic infections can cause the epilepsy. Injury before the birth. If your child gets the injury, like any pregnant woman get it, so they have the chance of neuromuscular or the epilepsy diseases. Before they are born, babies are sensitive to bone damage that could be caused by several factors. They might include an infection in the mother, poor nutrition, or not enough oxygen. This brain damage can result in epilepsy or cerebral palsy as well. Developmental conditions also. Epilepsy can sometimes occur with developmental conditions. People with autism are more likely to have epilepsy than the people without autism. Research also found that people with epilepsy are more likely to have ADHD, which is more common in children, the attention deficit hyperactivity disorder, which is known as, and other developmental conditions. Even the persons who have the intellectual disability, they may get it. Having both the conditions may be related to genes. So, what are the risk factors in that? Certain factors may increase your risk of epilepsy, like age, family history. If you have a family history of epilepsy, you may be increased risk of seizures, head injuries, strokes, and other vascular diseases, dementia, brain infections, seizures in childhood, etc. So, what are the goals of yoga intervention? Yoga may induce the relaxation and reduce stress by influencing the autonomic nervous system activities in the electrical activity and the neuronal discharge from the various parts of the brain, thereby controlling the seizures. So, what are the important yoga practices you can do? Like for the breath awareness, the pranayam, relaxation is more important in that. Asanas with awareness, with slowness, and also like Nadi Shodhan pranayam with the ratio of 1:1, you can do it without the intermediate, the holding of the breath, and also the Brahmari and the relaxation techniques. It will be more helpful. Avoid for the seizures are the headstand and the hyperventilation. It is very unlikely that certain practices could cause a seizure. Even a yogic practice, if it's high amount, if it's over exercised, it can cause. So do it very minutely and do it with a slow pace. So the precautions. Practices to be done should be slow paced, not overexerted. Always consult a yoga physician or a doctor before starting the practice. Triggers for seizures vary greatly. They can relate to the stress of a new environment, sensory stimulation like bright lights, low blood sugar levels, etc. Even before lunchtime, not you get the enough sleep on night before, or the menstrual cycles. Try to avoid stimulus before and after, like during the practice of it. And also you can go for the diets like the ketogenic diets, which are primarily foods high in fats with the most remaining calories supplied by the proteins. And this diet includes very few carbohydrates and is intended to induce a metabolic state called ketosis. Ketosis causes the body cells to use the energy substances called ketones, which are broken down into fats instead of glucose, which is broken down into the carbohydrates. So ketosis mimics a fasting state. A research shows that seizures often lessen or disappear during the periods of fasting in some people with epilepsy. Some people may able to stop the ketogenic diet after a few years and remain seizureless. You can do it. So this is all about the aspects of yoga and the diet. So a person should aware that do not over exercise in terms of seizures or epilepsy, and go in the mindfulness techniques like meditation, in the chanting, in the deep relaxation. It will be more beneficial for you. Thank you so much. I hope you have understood this session very well.